Good morning, good afternoon, good evening, wherever you're located. Welcome to the Voices from the Grassroots COVID-19 and Women from the Global South event. The Ontario Council for International Cooperation is very proud to have our Gender Equality Hub having worked hard and putting together this incredible project and initiative. And we're so amazed and awed to have everyone join here today. My name is Anika Zalmi. I will be our moderator, but I really want to center the voices of not only individuals who have taken part in in the work leading up to today's event, but also to really hand this floor to individuals from the communities from which we were able to learn so much through this project. So before we begin, I want us to start with a land acknowledgement. For those of you that come from an international context and may not be familiar, in Canada, we really want to work to honor the Indigenous communities that came before and continue to live, play, work on the land that we're on. This acknowledges a lot of the history that has led to the theft and the unaccepted or celebrated settling of individuals on Canadian land. So here we acknowledge that our office sits on the unceded territory of the Haudenosaunee, Anishinaabe, the Huron-Wendat, and the Mississaugas of the New Credit First Nation. And as we reflect here on the communities whose land we live on, we think about how we can take what we have learned or we will learn during our sessions today and move that to beyond words to action and think about how we can stand in solidarity with all of these communities, including those highlighted by our speakers today, to be better allies and better support. With that, once again, a warm welcome to all of you. Today is International Human Rights Day. And as I've shared, our Gender Equality Hub has been working really hard on profiling a series of stories from women and girls in the Global South, and specifically looking at how COVID-19 has impacted them in our current times and the ways that these impacts compound and are intersectional. So I just want to share another warm welcome, and I will actually hand before I hand it over to Julian, I want to do just a quick agenda. So we will actually have an introduction by Julian Maturia, who is from our Gender Equality Hub, who will cover just the overview of our project and the work that has been done. I will share then a quick video of the stories and interviewees from the field in the various countries that we learned from. Then I will hand over the floor to our speakers. We have Carmen Zubiaga from the Philippines. We have Najia Zewari from Canada, who's an Afghan national as well. And we have Carolyn Drileba from South Sudan, who is joining us from Uganda today. And after that, we will move into a quick breakout session. I will share a summary, and then we will hand the floor over to Maria Carmona, who is also from our Gender Equality Hub, to share closing remarks. So with that, Julian, over to you.
Thank you very much, Anika, and thank you everybody who's joined us this morning or evening or afternoon, based on where you are in the world. On behalf of all the individuals and organizational members of the OCIC Gender Hub, amongst them World Accord, Canadian Executive Service Organization, the Global Women's Network, and World Renew, represented by Isabel, Sarah Awad, Najia, Maggie, Maria Carmona, Celestine Muli, and myself, as well as the OCIC Secretariat under the leadership of Kimberly. Allow me to introduce this project. In April 2020, members of the OCIC Gender Hub came together to work on this project with the aim of creating a space for grassroots women and girls from the Global South to share their experiences with the world on how COVID-19 health pandemic has affected their lives. We know this has been told over and over the last few months in terms of how COVID has affected women and girls. However, this project really is unique in the sense that it aims to empower women and girls to tell their story in their own voice. And in their own voice, we've heard of their resilience, we've heard of their challenges, and we've also heard of gaps where they can still do with some support from development actors. Overall, the common theme remains. The COVID-19 health pandemic continues to magnify and exacerbate the already existing gender inequalities, making the vulnerable and marginalized even more vulnerable. These experiences represent 7 countries: Afghanistan, Guatemala, Kenya, Mali, the Philippines, South Sudan, and Uganda. This project also intends to elicit action to address the more immediate challenges of the pandemic, as well as the systematic and long-term gender equality issues. This includes rallying all actors to walk the talk towards creation and implementation of policies and programs that are gender transformative, that put women and girls and other intersecting minorities, such as persons with disabilities, the aging and ethnic minorities at the center, ensuring that not only are their voices heard, but their voices influence the design of the interventions that affects them. And this is also in line with this year's International Human Rights Day theme, which is today, as Anika's already stated, of recover better and stand up for human rights. We are taking this opportunity today in solidarity with our vulnerable and marginalized sisters and mothers from the global south, as well as from everywhere else in the world, to remind everybody that gender equality issues and women's rights issues are human rights. I think many times we tend to forget and separate human rights and women's rights. And women's rights and gender equality really remain central to the achievement of sustainable development goals. We hope that through this project, greater awareness will be created, more accessible funds will be made available, partnerships with smaller grassroots women groups and collaborations between multi-sectoral actors, including government, private sector, diaspora groups, religious organizations, media, etc. will be established, as well as accountability mechanisms will be strengthened in country, regionally, and in global spaces. This project also aims to reinforce the critical role of civil society organizations such as OCIC and its members as agents of change and empowerment for the global south. Today's conversation is only a teaser. You will be hearing more from this group in the coming year. To start us off, Anika is going to introduce a video for us. Welcome, everybody.
Thank you for that comprehensive overview, Julian. This, as Julian shared, I will be sharing now. Quick video from the field.
El país ha sido cerrado parcialmente, lo cual ha limitado la libre locomoción, también ha puesto una barrera de distanciamiento social. Nosotros actualmente somos un país donde nuestro pueblo es muy amable, donde se da abrazos, la mano. Así también la gente En general no cuenta con un chorro, no cuenta con un jabón gel para el cuidado de la limpieza, el aseo.
I suggest my community can best face the problems brought by Corona by sharing the little food they get from their garden and plant more food crops to feed their families and give some to persons with special needs. If I had a chance to speak to the world leaders, I would ask them to create jobs for the youth so that we can help our parents, the elder, and the disabled.
To support grassroots initiatives and community-based organizations. They can identify the problems on the ground and the community's priority needs. They are our first responders to the crisis, and they can help in implementing sustainable solutions.
Well, thank you all for sharing the space with us. I'm sure you've seen already some of our interviewees from the field, as well as one of our very own speakers, Carolyn, who is joining us here today. So with that, I will actually move us into the speaker section. And before I actually hand the floor over to our speakers, I will actually do a quick introduction. So we have first Carmen Zubiaga from the Philippines. She's a disability rights advocate and currently the executive director of Women with Disabilities Leap to Social and Economic Progress, WOW Leap, Incorporated, which is an organization of and for women with disabilities. She has held a senior position at the National Center for Disabled Persons in Cambodia under the UNDP, and has had a long career in government. After her retirement, Carmen continues her advocacy by traveling around the Philippines, delivering training on disability inclusion and giving inspirational talks to people with disabilities. Welcome, Carmen. We also are joined by Najia, who is the founder of Global Women's Network and also a member of our Gender Equality Hub. Global Women's Network is a grassroots women's organization bringing immigrants together from diverse backgrounds to share stories, talk about their challenges, and create solutions to common barriers that new immigrants, particularly women, face upon arriving in Canada. Najia has experience working in government, NGOs, including with UN agencies for over 15 years. She is fluent in English, Dari, Pashto, Urdu, Arabic, and basic French. She actually first came to Canada in 2013 and is very proud to have been part of the team that put together this incredible initiative and this event. And finally, we have Carolyn, who is joining us from Uganda. Carolyn is a 14-year-old schoolgirl originally from South Sudan, but now living in Yumbe District, Uganda. She is a student in Lukutua Primary School in Yumbe Town Council, and she helps take care of her 9 siblings while her mother works in Juba, South Sudan. Although she's still young, you will see that Carolyn has a deep and mature understanding of the world, including the challenges due to COVID-19. So with that, I will actually hand the floor over to Carmen, who will begin by sharing her story. Carmen?
Hello, good evening, and good afternoon, and good morning to everyone from the Philippines. Carmen Zubiaga. I'm in my 60s, and I work as a consultant at the same time the executive director of the women with disabilities lead to social and economic progress. And my life before COVID has been very active. And I move around. I go to different parts of the Philippines to give trainings and inspiration to persons with disabilities in the rural areas. And it has been a very active life for me. So when COVID pandemic was at its peak, the national government declared the enhanced community quarantine in the in the national capital region and the neighboring region where we are also very much affected, wherein we have very limited mobility. And suddenly I felt so frustrated being at home. My first weeks at home were quite, I thought I could do something that I could focus on. I could do my work, but I could not concentrate because of what I'm hearing from the social media, and many persons with disabilities are connecting with me and telling me how life was so hard for them because they stopped working, and especially for persons with disabilities in the informal sector, they totally lost their income and waiting for the government to deliver the relief food packs for them. But they were all most of them were frustrated that they have to call for help. So I feel that I could not do anything because we were all stuck at home. But of course, there's social media and many friends are connecting, and I can still connect with most of my friends who could also help. And it's really sad that the COVID testing centers are not very open, and there are very few in the Philippines that since we could not go out and it was very expensive and we could not afford it, we just do some preventive measures. And since then, I started experiencing to be at home for the straight 2 weeks to be at home. And really my life changed. But I realized that I have to move on and do my and spend my days productively. And what really bothers me were the people asking for help, especially those who are blind massage therapists who were always who always give me messages that they had nothing to eat, they could not go out. So I thought of reaching out to my friends and some people in the government whom I already knew. And I just instructed them to give me a list of their names, the names of their members. So I connected them to the donors, and was able to provide at least 1,200 families with food packs delivered right in their homes. That was good for me, but I also my days were always filled with talking, connecting with people, and during those times of hopelessness for everyone, I thought of uh, coming out in the social media live and interview people who can give also hope. So uh, I I uh, I go on Facebook Live every 2 days and provide them with uh, some sort of inspiration that everyone is doing it, but we have to be resilient. We have to be strong. And I also realized that people with psychosocial with disabilities were among the groups that were traumatized and stigmatized during the COVID pandemic. And since I have a group of one group chat with people, all of them with psychosocial disabilities, their main problem was where to get the medicine since there were no stocks and they could not get anything from the government because the government had already run out of stock. And it was so sad that most of them were already talking nonsense, and most of them were hopeless. Most of them were starting to feel so depressed. And it also affected me so much because I used to cheer them up, but somehow I had been affected also by their feelings, what they were relaying, especially in the social media, which was the only avenue for us to communicate. And to avoid some situation, I again connected to some of my friends and donors, and specifically asked for medicines for people with psychosocial disabilities, especially those who have depression and epilepsy. Although we only help in some small amount, at least it gives them the relief and it gives them the assurance that people are ready to help them. And that has been a way of helping to connect them with people who can help. And what I feel about the situation is there are times that I also was very much affected. And sometimes I could not appreciate what I have, that I was not, that I have enough food, I have a shelter, and I have my family with me. But as days gone by, a month, we engage in we have a group that engage in research of the experiences of persons with disabilities, and we heard more from them. It was really so disgusting, or we are really very sad that during those times, many women experienced abuses, and it was openly told by UNICEF and other groups. But we have to move on, and somehow we get used to it after months. And right now we have to live our life in the new normal, and women together we face a new normal and become better to recover after this, thinking out of some recovery measures for persons with disabilities in the coming months. Thank you very much. And I also thank my fellow women who are here, who joined me in our initiative for this very meaningful activities that we shared together, even online. We are happy that we have already beat the pandemic with our attitude, as we are women facing the new normal. Thank you very much.
Thank you so much, Carmen, for that incredible, deeply reflective reflection. Najia, I will hand the floor to you.
Good day, everybody. Today I'm sharing my observations, so it is basically just my own thoughts. Afghanistan and Canada recognize the Universal Declaration of Human Rights that we celebrate today. Today we are meeting virtually because the world is challenged by a pandemic that kills thousands every day and made humans suffer in millions. In a normal setting, women, children, and disabled are easy target to any tragedy, and of course, they are suffering more when there are disasters. When COVID pandemic started here in Canada, I was witness of how government, NGO, and communities were ready to respond to it by providing emergency funds, healthcare facilities, and food packages. Even the cloth masks to make sure people have masks if there is shortage of mask supplies. The women groups came together and provided free meals to those in need in the community, even to frontline workers. Also, in some communities, women organize virtual healing circles to decrease the stress level. There was a strong rule of law supervised by police to ensure safety of all. After the decline in the pandemic cases and when the travel by air was allowed, I decided to travel to Afghanistan to organize my son with me. He was engaged for almost a year at a time and he needs to bring his wife to Canada. This was a big worry for us as the immigration works also takes so long. So we ran and traveled. From airport to airplane to landing, everything was not normal. But the travel from Dubai to Kabul were packed, no social distance. Only here hostess announced, please keep on your mask. When I arrived in Kabul airport, the first things I noticed were very few people wore masks. Despite it was just the decline time, but still that the city was crowded and many people were walking around without practicing social distances, wearing masks, and even using sanitizers. I asked an educated person why you do not wear masks. The answer was, we defeated Corona with amazement, no need to wear masks. Afghanistan in Human Development Index placed 170 out of 189 countries and territories. 90% of population live under poverty line. It means economic growth in general is slow due to ongoing conflict for more than 4 decades. I had the chance to visit different economic categories, the upper middle class, lower middle class, and poor families. All these families were struggling with having income to feed their families. Surprisingly, all families got sick with COVID-19 and treat themselves with medicine prescribed by doctors and herbal remedies. There were some lost, but people were not willing to name these deaths because of the corona as of the stigma around this disease. Few families declared of having their family died of the virus. Loss of people jobs in the private sector was a major issue while government still asked their civil servants to be at work. Being out of school for children and youth was another problem. Online education was not an option as neither the teachers nor the students had the means to use internet. Also, electricity load shedding was an issue due to lack of security. Hospital had limited capacity in medicine to respond to the cases. Not many people took their sick families to the hospital as they cannot afford it. In an informal chat with one women rights activist, I asked her how women have managed during COVID. She said, we have more urgent and horrible enemies that are Taliban, suicide attack, and killing of civilians. Our fight is big and a difficult one. Families have COVID patient, and on the top, they are losing their dear ones in these killings. Today, in this moment, in the International Human Rights Day, a young woman journalist and activist was assassinated in eastern province of Nangarhar. It is a very painful moment for all women of Afghanistan because it become a practice every day. Afghanistan is really an unsafe country for women. And like everybody's heart, including me, we want to cry because it is a ongoing things. I was a guest, and whenever I visited, there was some offers, even a cup of tea, as hospitality is one of the uniqueness of Afghan culture. But I noticed that people were poor and needy. There was limited support by government. For a period of time, they distributed wheat and bread. Many beggars were on the street. Shops were open but not having income, and sales were very low. The economic crisis are same as in any other countries in the world. The price for medicine jumped high as most of the medicines are imported. Talking with head of a shelter, they had hard time during the pandemic. They had shortage of resources as there were cuts in the funds they received. The emergency response system was not ready at all to manage the crisis. She also mentioned because men stayed at home, there was not many violence against women cases reported as they cannot go anywhere in presence of men at the home and in absence of communications tools during pandemic. The message I heard was COVID situation is not new for us. This was like surprisingly encouraging for all of us to listen. We have been in a situation far worse. It is a well-known fact that during critical situation, people show their utmost personality, and we are so proud that our community rise in its best. Compassion, empathy, kindness, willingness to help each other despite our own struggles. This shows that resilience of in that communities, and we are happy that we all survive despite ongoing security threats to the community. I heard clearly that they said international community, beside having their priorities of their own nations, should not forget the people in global south. To sum up, the international partner for Afghanistan should consider gender-sensitive in humanitarian responses, ensuring access to service for survival of violence against women and girls, support the women meaningful participation in peace process, no deal on women human rights as these women already suffering. Make sure that COVID vaccine for in war and poor countries are available. Thank you very much.
Thank you so much, Najia. And finally, I will hand it over to Carolyn in Uganda to share her thoughts. Oh, Carolyn, you're muted.
Is it okay?
Yes.
Is it okay now?
Yes, we can hear you now. Great.
Okay.
My name is Drileba Carolyn. My name is Drileba Carolyn. As far as I'm concerned, there are 14 cases of coronavirus in my community, and I am aware of the preventions. What I know is the prevention measures of the COVID-19 are washing hands frequently and wearing masks. Also, social distancing. While schools were closed, because of the corona since March 2020, I have been getting money by washing clothes for people and fetching water in the neighboring places. A jerrycan costs me 200 to 300 shillings. In the 4 months, I collected 20,000 shillings. Because of the COVID-19, we have been suffering in very many ways. At first, we used to eat 3 times a day, but these days we eat once in a day. In our family, my mother used to sell beans in the market. Since the lockdown came, markets were closed and her business was declined. The problem which affected me most is not what the problem which affected me most is missing of lessons and enough support from girls who used to help me. The group of people who had been stigmatized in my community are the South Sudanese refugees. Because of the COVID-19 reported in North Uganda, most especially in West Nile. My concern about the COVID-19 is that the government should step down to us because we are suffering a lot because of the lockdown. And the government should follow the corrupt leaders closely because they eat the money that is being sent to the vulnerable people. What I have done during the COVID-19 period is I have talked to the children in the area about bad sides of fighting. I organized and led prayers in their homes with their children and family members. I supported my mother and other community members by fetching water and washing clothes. I supported my mother by buying soap and salt. As far as my health is concerned in my sight from the government, no woman, men, girls, boys, and the disabled has received support from the government in the community. Who else has helped us in the COVID-19 pandemic is Plan International, which provided us with a pad, pants, and a bar of soap. I can suggest best my community can solve the problem brought by corona by sharing the little food they get from their garden and they give to the people who have special needs. Suppose I had a chance to speak to the world leaders, I would like to tell them that they should create more jobs for the youth such that we help our parents, the elderly and the disabled. Thanks.
Thank you so much, Carolyn. It's such a pleasure to hear from you and hear from your personal experience. So thank you once again to all of our incredible speakers. Now, in order to ensure that we're taking what we've learned and using it for action, we will be breaking each of you out into a breakout group to reflect on the following questions. As I go through these questions, if you require a French room, we do have the option to have one room completely and a discussion completely in French. Please drop in the chat note that you would like to be in the French room, or create an asterisk beside your name by renaming yourself. So in these groups, I invite you to reflect on the following questions. First of all, how does listening to this conversation make you feel? Second, what is your most important takeaway? And finally, what action will you take based on this learning? So with that, I will open the breakout rooms. It doesn't seem that we necessarily have anyone who specifically needs a French room. So I will just mix everyone up and have the opportunity to have these discussions. You should have seen the invitation to join the breakout room now. If you haven't, please let me know. Hello, everyone. I just wanted to drop in. I will be your facilitator. So the three big questions I invite you all to share: how has this conversation made you feel? What is your most important takeaway? And what action will you base on this learning? So please feel free to share, whoever would like to start. I will be taking notes.
Hi, I'm sorry, I can't turn my camera on. Good morning, everyone. My name is Vida. So, thinking about this, well, I think it's very important to hear voices that normally they don't have a platform. So I appreciate, the effort to bring them together and to give us the opportunity here to hear them. I want to reflect on the person from Philippines, right? Philippines.
That's correct, Maria.
Yes. Well, we here we have challenges for people with disabilities here in Canada, and I believe OCIC is participating in some project for the city of Toronto that's happening soon on this issue. So how it makes me feel, it like, you know, I feel that the challenges that I face are with COVID-19 are minor to some people in developing countries. And in fact, I feel, you know, uh, the urge to maybe think and amplify their voices if I can, in a way. Um, and I feel inspired because they are at the same time they are still, you know, uh, uh, despite all the challenges, all the speakers, they know what they want, so they have a voice and they speak about what they want. They were identifying their challenges, and I heard um, the again, I'm not good with name, the person with the letter C, Carlon.
Carolyn, yes.
Yes, for example, he clearly stated what he is expecting from, or in terms of policy making, when I hear them saying, for example, creating opportunities for employment, etc. So while I feel my challenges, or I feel that my challenges are not as big as I imagine them, I feel also I'm inspired to keep going, or maybe you know, to keep going maybe, and maybe to take action or some action. Um, um, it, you know, maybe to have their voice heard or to communicate their needs. So this is basically what I was thinking.
Thank you so much, Rita. Is there anyone else who wants to share? I'm also noticing we have 2 minutes left in
Oh,
this breakout session. It's a very quick breakout session.
Yeah, my name is Ray. I'm from Toronto.
Ray.
I'm just gonna, just gonna go through very quickly because I know we don't have much time. It was really nice to hear, to listen to all those women talking about what they've been going through or what they've experienced during COVID. Listening to Caroline, I feel it makes me feel really privileged just to be in Toronto and in Canada generally. And it makes me realize that we are not all experiencing COVID-19 the same. There are people who, even though we feel like we are suffering here, there are people who are going through a harder time, like Caroline said, about lack of food in the community. So just not having basic life necessities. And then it also inspires me that what I'm doing for my work to kind of do more. It challenges me to do more advocacy for the women who usually don't have a voice or a platform to amplify their voices. My biggest takeaway or important takeaway is that women and girls seem to be affected, especially more during this crisis. I work with school-age girls going to university, and I know that they are also suffering more than we are here. So in the action that I think I would take, I'm sorry, I'm going really fast because we don't have much time.
Okay.
The action that I think I'll take, we'll have to look back into our programming and see whether we can include things like food insecurity when we provide the educational support, and what else we can provide the young women that we are working with in the countries where we work. Thank you.
Thank you so much. I'll be closing the breakout room now. Thank you so much. And around Virginia, Les, thank you so much for being here. Feel free to share anything you might have to share, either in the chat or afterwards. I will be hopping back into the main room. Thank you so much for sharing, everyone. Hello all and welcome back. So I see people are still coming back now. So hello all and welcome back. I see that most, if not all, individuals are back. Just in the interest of time, I would have liked for each of the breakout room facilitators to share what the conversation was, but based on some of the notes that I'm seeing coming in, I'll just share very quickly before I hand it over to Maria. It seems that a lot of individuals are really thinking about how privileged we are, a lot of us, to sit in a space where we can even access webinars like this, or even engage in conversations like this. And I think the biggest takeaway that I'm seeing coming across all of the different groups is just how COVID affects people differently, and that we, especially women and girls, and those in developing countries, are disproportionately affected by COVID and all of the challenges it presents. So things such as, we're not experiencing COVID the same, that we need to rethink how we're telling stories, and that we're really providing an accurate reflection of the challenges and the realities that people are experiencing. I see that some of the actions that people are thinking about are amplifying voices, especially those that are not traditionally showcased or amplified within these spaces. And really thinking about what it is that we can do in our own individual space, whether that's, for example, as an educator and talking more about food insecurity, whether that's as an advocate, and really highlighting the disproportionate ways that COVID affects individuals, especially people. And I'm also seeing in the chat, also thinking about doing political advocacy on behalf of these individuals. So with that, and a fruitful but quick discussion, I want to just say a huge thank you to all of you for joining from the OCIC team. And I actually hand it over now to Maria Carmona from the Gender Equality team, Gender Equality Hub, to share closing remarks. Maria, the floor is yours.
Thank you, Anika. We have come to the end of today's breakfast dialogue, but from all that I have seen and heard today, I am confident that this is not going to be the end, but rather just the beginning of more collaboration as we all work towards a more equitable world where no one is left behind. 8 months ago, I had the privilege of meeting the team that put together this storytelling project. And look where we are right now. We came from diverse backgrounds and representing different organizations, but we all had a unified vision for this project. That is to amplify the voices of women and girls from the Global South on their challenges, resilience, and triumphs in facing the impacts of COVID-19. What we have heard today from Carmen, Najia, and Carolyn is just a foretaste of the stories we have gathered. The group, together with the OCIC, is working to put these stories into a digital flipbook format to be launched within the first quarter of 2021. With this format, we are hoping to widen the reach, create more awareness, increase advocacy efforts, and elicit action to uplift the lives of these women and girls. We will be reaching out to you again to share the recording of today's event and to give you more information on upcoming events. We take this opportunity to thank our speakers. Carmen, your life as an empowered woman is inspiring. Thank you for opening our eyes on the importance of disability inclusion. Najia, it has been a pleasure working with you on the team. Thank you for helping us see the realities in Afghanistan through your lenses. Carolyn, you are amazing. You are young, but wise beyond your years. Keep doing what you are doing for your family and community. We also take the opportunity to thank all the participants in today's event for your interest, active participation, and resolve to take action from what you have heard and learned with us today. Let us not let these voices fall on deaf ears. We also take a moment to acknowledge those who were instrumental in bringing this project to where it is today. Our interviewees, some of whom are present here today, such as Rina De Luna, Jaya Boera, Teresita Poria, Virginia Rabino, Mona Visperas, Bless Adriano, and the solidarity of oppressed Filipino people led by Secretary General Cherry Barnuevo and President Patricia Herrera. Field researchers and partner organizations. Last but definitely not the least, the OCIC team led by Kimberly Gibbons, together with Anika, Marilyn, Lisa, Ohenia, and Eliza for providing financial and logistical support. The success of this project would not have been possible without all of your contributions. On that note, we say a big thank you, keep safe, and happy holidays.